Okay, so fatigue. So fatigue is probably one of the number one side effects of chemotherapy. In fact, about 75% of all patients will be experiencing some fatigue, mostly because it definitely, most chemotherapies do have a big impact on mitochondria, and specifically as fatty acids are transported on mitochondria, plus also with the destruction of cells, you're also having a great increase in cytokines, which are inflammatory markers. So these are some of the big reasons, and then just even the stress alone with diagnosis of cancer, plus also the fact that both the cancer itself, but then also chemotherapy treatment can have a big impact on nutrients and specifically diet. So some of the main things that we might recommend for fatigue, the biggest would be L-carnitine, and basically the reason L-carnitine can be useful is that it really helps to allow the transport of these fatty acids into the mitochondria as an energy source. Another anti-fatigue supplement that I would recommend also, or herb, is ginseng. So ginseng is one of our adaptogen herbs. So it's an herb that helps with adrenals, and it's very energizing. And some of the other added benefits of ginseng specifically, not so much just in the fact that it gives you energy, but also looking from the cancer treatment side, ginseng is very good for increasing immunity, and so having a strong immune system is very, very important when it comes to clearance of cancer. Plus, it's also strong antioxidant and also very good with inflammation. So ginseng is also just around really great herb, and it seems from most of the studies showing no interaction with chemotherapy. And I'm going to be, there's a couple supplements I'll be mentioning during this presentation that, though they can be helpful with side effects, they are not necessarily recommended while you're actually on chemotherapy. Okay, so muscle cramps. So the big reason why muscle cramps can happen during chemotherapy is one is the depletion of nutrients, specifically magnesium, both in affecting the absorption and also rapid excretion, but then also inflammation. So inflammation that's also occurring directly from the cancer itself, but also as an effect due to chemotherapy. So some of the big things that we would recommend specifically for muscle cramps would be magnesium. Magnesium can be either taken orally or also topically, whether it's a cream, lotion, or even a Epsom salt bath could be really beneficial. The other big one is CoQ10, and CoQ10, similar to L-carnitine, really helps with mitochondria and shuttling of fatty acids across mitochondria. And then lastly, curcumin. So curcumin comes from turmeric. It's very anti-inflammatory, and similar to ginseng, it also has other properties as well that can be beneficial for cancer, in the fact that it is a strong antioxidant and also helping with prevention of tumor progression. So it kind of get a little bit of extra benefit. Okay, so memory and depression. So unfortunately, most chemotherapies can pass the blood-brain barrier. So meaning that even though we're not trying to target the brain, specifically when it comes to breast cancer, it does have the ability to pass and could negatively affect the brain. And studies have actually shown that, what they sometimes call like chemo brain, which is like difficulty with memory, feeling foggy headed, that this can actually persist even after chemotherapy. So chemotherapy typically, depending on the severity, can last anywhere from 3 to 6 months, but we're studies actually showing women still having the negative cognitive effects years after after chemotherapy. So what are some of the main things? So things that could definitely help. Fish oils, specifically. So with fish oils, you have two different components. You have EPA and DHA. DHA component as very good, very important for cellular membranes, and specifically when we're thinking about cellular membranes of the cells in our brain, a very high content of DHA, so building up our DHA reserve through fish oils. Acetyl L-carnitine, again, very similar to how we discussed L-carnitine, but specifically it has better transport with the blood-brain barrier, and that can really help with memory, specifically because of its target of mitochondria. And then lastly would be vitamin D. And vitamin D is another one of these nutrients where it has double benefits. So in addition to helping with the depression and memory, vitamin D in itself has very strong anti-cancer properties. Typically in my practice, for most patients, I recommend having blood levels of vitamin D at least around 50, specifically for women, because one, it can help with cancer, and then for women of childbearing age, it's more beneficial to have levels around 50. Okay, so mouth sores. So mouth sores, again, if we think back in the beginning when I was talking about how chemotherapy affects rapidly dividing cells, and I was talking about the cells of our GI tract. Well, our GI tract starts in our mouth, and this is one of the largest side effects, unfortunately, to chemotherapy. And it might sound very benign, but unfortunately, it can really affect women and also men, depending. I mean, we're talking about breast cancer, but even chemotherapy for other cancers, but can really have an impact on nutrition. So, I mean, thinking about the difficulty, I mean, another side effect, unfortunately, of chemotherapy is nausea. And then if you're also adding on top of that, painful eating. So the target or the nutrient that we recommend would be glutamine. And so glutamine is it's an amino acid. It's actually non-essential, meaning that our bodies actually do make glutamine, but making sure that you're getting enough glutamine can really help prevent mouth sores. Now, this is one of the cases of a nutrient that actually is more beneficial that you would start it prior to actually starting chemo. And then another added benefit, besides the fact that it can help to prevent mouth sores, is that in some studies, glutamine has shown to actually improve the effectiveness of certain chemotherapy agents, specifically tamoxifen, which is very often used, or almost used in most breast cancer cases.